organizations must constantly review all the risk throughout their entire operation and incorporate risk management into all planning and decision-making activities. Risk refers to an undesirable outcome and its consequences. While some risk can be unvoiced, maintaining a positive HR strategy can lessen the risk levels. HR can be directly impacted by risk items such as payroll fraud, recruitment scams, or even corporate espionage. In some cases, cyber attackers have found numerous routes into organizations through HR. Additionally, some organizations may store large amounts of sensitive customer and employee data. Cybersecurity is an example of an increasingly important topic, especially as artificial intelligence, ransomware, bring your own device policy, and application programming interfaces that connect HR systems have brought new benefits to the workforce. But the adoption of these technologies, along with a rise in sophisticated new forms of cyber attacks, has created new risks to the security and privacy of sensitive HR data. Risk will exist in multiple areas of an organization, whether dealing with internal fraud or costly errors due to personnel risk, or risk of physical assets by destruction or theft. There are even relationship risks, external fraud and technology risks such as malware or viruses. There are various ways of dealing with or mitigating risk to an organization. One direct way to deal with risk is to abate it or eliminate it. This means to completely avoid the risk, meaning an organization would basically stop providing that product or service or doing the activity because it's simply too risky. Another option could be to mitigate or reduce the risk. This changes the activity to reduce the likelihood of the risk occurring or reduce the severity of the consequences. This could involve developing policies and procedures around a process. One may also transfer the risk. This is done by the purchase of insurance, which transfers the risk to another organization through a signed contractual agreement and the payment of a premium. There's also an option to simply accept the risk. This could simply mean that there's an awareness to the risk. Perhaps it's an activity that's central to the mission of the organization. The organization will likely choose to accept the risk. HR will often be tasked with conducting needs analysis, conducting risk assessments, or conducting threat assessments. The hope is to learn about new risk and take appropriate proactive action to satisfy the risk. Each risk will need to be assessed and evaluated based on the likelihood or frequency of the risk occurring, as well as the severity of the consequences. A job hazard analysis is one type of risk assessment. A job hazard analysis, also known as a job safety analysis, is a technique that focuses on job tasks as a way to identify hazards before they occur. It focuses on the relationship between the worker, the task, the tools, and the work environment. Ideally, after you identify uncontrolled hazards, you will take steps to eliminate or reduce them to an acceptable risk level. Supervisors can use the findings of a job hazard analysis to eliminate and prevent hazards in their workplaces. This is likely to result in fewer worker injuries and illnesses, safer, more effective work methods, reduced workers' compensation costs, and increased worker productivity. The analysis can also be a valuable tool for training new employees in the steps required to perform their jobs safely. Within the Occupational Safety and Health Act of 1970, Congress created the Occupational Safety and Health Administration, otherwise known as OSHA, to create safe and healthy working conditions, setting and enforcing standards, and providing training, outreach, education, and assistance. OSHA is part of the United States Department of Labor. The administrator for OSHA is the Assistant Secretary of Labor for Occupational Safety and Health. OSHA's administrator answers to the Secretary of Labor. An OSHA inspection could occur at any time. It's important to plan for an inspection by making sure we have the key items in place prior to the arrival of OSHA. The likelihood of an OSHA inspection is dependent on the priority level as defined by OSHA. There are several different priority levels. An imminent danger situation is the top priority. This indicates a hazard that could cause death or serious physical harm and receives absolute top priority. Compliance officers will ask employers to correct these hazards immediately or remove endangered employees. Imminent danger inspections are given top priority by OSHA so that severe harm or death can be prevented. A severe injury and illness situation is the second most prioritized event. This occurs when a fatality or catastrophe, which is defined as an accident that requires hospitalization, occurs to 3 or more workers. In these events, employers must report all work-related fatalities within 8 hours, and all work-related inpatient hospitalizations, amputations, or losses of an eye within 24 hours. A worker complaint inspection is based upon allegations of hazards or violations and is considered the third priority. Employees may request anonymity when they file complaints. However, they must sign the complaint and also include specifics about the alleged violation. The compliance officer may ask to inspect other areas not mentioned in the complaint. OSHA may also conduct an inspection based upon the receipt of referrals from other federal, state, or local agencies, individuals, or organizations, including the media. Targeted inspections are aimed at specific high-hazard industries or individual workplaces that have experienced high rates of injuries and illnesses, which will also receive top priority. A follow-up inspection, which is a check for abatement of violations citing during previous inspection, is also conducted by the agency in certain circumstances. When a workplace injury occurs, an investigation should occur. This should include a thorough review of the accident scene, interviews with employees, and a clear documentation of findings. This is not only due to regulatory requirements of injury tracking, but also provides historical accident data that could be used in future risk planning. This information may also need to be recorded on OSHA logs and reported promptly. OSHA has specific requirements for injury and accident record keeping and reporting. With the exception of some low-risk industries, such as a software developer or author, most employers with more than 10 employees are required to keep a record of serious work-related injuries and illnesses. This does not include minor injuries only requiring first aid. Injury records must be maintained at the worksite for at least 5 years. Each year during the time period of February through April, employers must post a summary of the injuries and illnesses recorded during the previous year. If an employee requests copies of the records, they must be provided to current and former employees as well as their representatives. Filings can be done electronically through OSHA's online injury tracking application. There are 3 main forms required for injury and illness record keeping: Form 300, Form 300A, and Form 301. Form 300 is more of a log than a form. This is a log of all work-related injuries, covering each illness, their severity, the employee injured, the date of the accident, and any other details that help classify the case. The log tracks various types of work-related injuries, such as those requiring care beyond first aid, injuries that led to loss of consciousness, or time off work, as well as injuries resulting in work restrictions or work transfers. This form will also cover diagnoses of cancer, chronic diseases, broken bones, teeth, or punctured eardrums. Finally, this form is used to report employee deaths due to work-related injuries. With OSHA Form 300, the supervisor is required to document the injured employee's name, job title, and case number. OSHA Form 300 also asks for the outcome, including days away from work or a job transfer. OSHA does maintain timeframe requirements, requiring that employers must report any worker fatality within 8 hours and any amputation, loss of eye, hospitalization of a worker within 24 hours. Form 300A is a summary of our Form 300. Form 300A is an annual summary of all events submitted from the OSHA Form 300 log. Each entry from Form 300 is matched to the corresponding lettered column on the log, with the corresponding lettered blank space on the summary. The employer must complete the establishment information section and have the summary signed by an authorized executive of the company. Employers must post the summary in the workplace from February 1st to April 30th of the year following the year covered by the form at each job site in a conspicuous area where notices to employees are customarily placed. Form 301 is an extended detail of an event recorded on Form 300. This must be completed on each recordable injury or illness entered on the OSHA 300 log. This is essentially an individual incident report that provides added detail about each specific recordable injury or illness. This must be completed no later than 7 days after learning of a recordable workplace injury or illness. Employers don't have to submit a completed Form 301 to OSHA. Instead, they need to retain the form on file for at least 5 years after the incident occurred. OSHA inspectors rarely give advance notice except in particular circumstances. The best time to think about and plan for an inspection is before one happens. In many cases, specifically trained employees may be designated to act as the representative during an OSHA inspection. Overall, the best preparation for an OSHA inspection is having a robust safety and health management program and that all OSHA processes are followed and understood. The first step before an inspection is for the compliance officers to research the inspection history of a worksite using various data sources. They also review the operations and processes in use and the standards most likely to apply. They gather appropriate personal protective equipment and testing instruments to measure potential hazards. The on-site inspection begins with the presentation of the compliance officer's credentials, which includes both a photograph and a serial number. An opening conference is held where the compliance officer explains why OSHA selected the workplace for inspection and describes the scope of the inspection, walk-around procedures, employee representation, and employee interviews. The employer then has the option to select a representative to accompany the compliance officer during the inspection. An authorized representative of the employees, if any, also has the right to accompany an inspector. The compliance officer will consult privately with a reasonable number of employees during the inspection. Following the opening conference, the compliance officer and the representative will begin the walk-around. During this process, the inspector will walk around the portions of the workplace covered by the inspection, inspecting for hazards that could lead to employee injury or illness. The compliance officer will also review the worksite injury and illness records and ensure the posting of the official OSHA poster. During the walk-around, compliance officers may also point out some apparent violations that can be corrected immediately. While the law requires that these hazards must still be cited, prompt correction is a sign of good faith on the part of the employer. Compliance officers try to minimize work interruptions during the inspection and will keep confidential any trade secrets observed. After the walk-around, the inspection is detailed, and the compliance officer holds a closing conference with the employer and the employee representatives to discuss the findings. The compliance officer discusses possible courses of action an employer may take following an inspection, which could include an informal conference with OSHA or contesting citations and proposed penalties. The compliance officer also discusses consultation services and employee rights. The employer must then respond in writing within 5 working days, identifying any problems found and noting corrective actions taken or planned. If citations, penalties, and abatement dates are not challenged by the employer or settled, become a final order of OSHA. Alternatively, the employer has the right to contest the citation within 15 working days if they feel the violation is not justified or penalty is excessive. When OSHA issues a citation to an employer, it also offers the employer an opportunity for an informal conference with the OSHA area director to discuss citations, penalties, abatement dates, and any other information pertinent to the investigation. The agency and the employer may work out a settlement agreement to resolve the matter and eliminate the hazard. Employers also have 15 working days after the receipt of citations and proposed penalties to formally contest the alleged violations by sending a written notice to the area director. OSHA then forwards the notice to the Occupational Safe and Health Review Commission for independent review. Employers may also choose to participate in the OSHA on-site consultation program. This is a no-cost safety and health consultation program which is separate from the OSHA inspection effort. On-site consultation services are separate from enforcement and do not result in penalties or citations. Consultants from state agencies or universities work with employers to identify workplace hazards, provide advice for compliance with OSHA standards, and assist in establishing and improving safety and health programs. The consultation is confidential and will not be reported routinely to the OSHA inspection staff. The only obligation for the organization is to correct serious job safety and health hazards in a timely manner. Workers' compensation insurance provides medical expenses, lost wages, and rehabilitation costs to employees who are injured or become ill in the course and scope of their job. It also pays death benefits to families of employees who are killed on the job. Employees of private organizations would file for state workers' compensation benefits through their employer. The only federal workers' compensation would pertain to federal employees who sustain job-related injuries or illness. Workers' compensation is considered a social insurance benefit, as it relies on a social contract between management and labor, where in exchange for purchasing workers' compensation insurance, business owners are protected from civil suits from their workers who become injured on the job. A system called experience rating is the amount of cost that an insured party experiences compared to the amount of loss that similar insured parties have. This allows for modification of the class rates based on the loss history of an individual business, meaning workers' compensation would be less expensive on an administrative assistant compared to a roofer, based on historical injury trends. This system provides business owners a significant amount of control over the cost of their workers' compensation premium. Safe businesses are rewarded with lower premiums, and unsafe businesses are penalized with higher premiums. It is also important to have a well-established crisis management plan. A crisis management plan outlines how your business will respond if a crisis occurs. This plan should identify who will take action and what their role will be. Having a proper plan on file can make the process much more efficient and successful. Dependent on the risks of the organization, crisis management planning could come in various forms, such as directing work to another location due to weather, planning for an electricity outage, or even something such as international ransom insurance for an executive business traveler. The actions taken in the initial minutes of an emergency are critical. Having a proper plan in place prior to an event will be successful for business resumption after a disruption. A focus on prevention will be key in effective resiliency. There is much that a business leader can do to prepare their organization for the most likely hazards. Business continuity planning, also known as business continuity and resiliency planning, is the process of creating systems of prevention and recovery to deal with potential threats to a company. In addition to prevention, the goal is to enable ongoing operations before, during, and after the execution of a disaster. A return to work program, also known as a RTW program, is a plan established by a business to return injured employees to the workplace as soon as they are medically able. Effective return to work approaches can help employees work while still recuperating, protecting their earning power and boosting an organization's output. This can include coming back to work part-time or in increments that support a healthy return to work process. The employee and employer should work together to understand the return to work process and provide any reasonable needed accommodation or resources to assist in getting employees back on the job quickly and smoothly. Occupational violence or workplace violence is the act or threat of violence ranging from verbal abuse to physical assaults directed towards persons at work or on duty. This could cause bodily harm, psychological issues, or possibly even death. Any action, whether verbal, written, or physical, that is intended to cause or is capable of causing death or serious bodily injury to oneself or others or damage to property is considered workplace violence. Stalking, threats, inappropriate communication, verbal harassment, defacing of property, invasion of privacy, and confining or restraining victims are also types of workplace violence. Each employer should establish a workplace violence prevention program or incorporate the information into an existing accident prevention program, employee handbook, or standard operating procedure. It is critical to ensure that all employees know the policy and understand that all claims of workplace violence will be investigated and remedied properly. It is critical to ensure that all employees know the policy and understand that all claims of workplace violence will be investigated and remedied promptly. Additionally, a domestic violence policy should be in place that highlights the employer's acknowledgement that domestic violence happens and may impact the workplace, and that employers will do what they can to accommodate those experiencing it. No federal law explicitly protects victims of domestic violence in the workplace or permits them time off to deal with it. However, several states have passed domestic violence leave laws which give victims the right to take time off of work for certain domestic violence-related reasons. The Federal Family and Medical Leave Act, FMLA, may also provide a right to time off for some workers who are facing domestic violence. Employers can incorporate information about awareness of domestic violence into employee orientation, wellness, and safety programs. The best prevention is always training. An organization should appropriately train employees, managers, and supervisors on procedures for responding to workers' reports of injuries, illnesses, and accidents. Training should also occur that includes ways to avoid the discouraging of reporting. This training should provide workers and managers with a greater understanding of the safety and health program itself so that they can contribute to the development and implementation. Proper training can also help employees recognize warning signs in others. Employee assistance may be necessary when certain signs begin to appear. HR may be reluctant to dig into employees' personal lives, but by providing support for abused employees, HR professionals may be able to help prevent tragedies. Alcohol and drug abuse by employees may cause expensive problems for business and industry, ranging from lost productivity, injuries, as well as an increase in health insurance claims. The culture of the workplace can play a large role in whether drinking and drug use are accepted and encouraged or discouraged and inhibited. Companies and employers, large and small, can adopt a workplace substance abuse policy that will reduce the loss of productivity and produce a safe work environment for everyone. An Employee Assistance Program, or EAP, is a voluntary work-based program that offers free and confidential assessments, short-term counseling, referrals, and follow-up services to employees who have personal or work-related problems. These services address a broad and complex body of issues affecting mental and emotional well-being, such as alcohol and other substance abuse, stress, grief, family problems, and psychological disorders. Counselors staffed by the service can also work in a consultative role with managers and supervisors to address employee and organizational challenges and needs. Many EAPs are active in helping organizations prevent and cope with workplace violence, trauma, and other emergency response situations. It's also important that HR helps leaders identify signs from employees so they may refer employees to the services of the EAP when needed.